What would have happened if we hadn't adopted a dynamic zero-COVID strategy? Based on a theoretical model, let's build a community of 10,000 people. Assume that the white zones are the residential areas of the community, and the blue zones represent public open space. Once we put an Omicron-infected individual marked as a red dot into the area, we can see that the virus starts to spread uncontrollably. Considering the age distribution and immunization levels of China's population, we theorize that one person can infect 3.4 people, which is calibrated on the initial growth phase of the 2022 Omicron outbreak in Shanghai, before a large-scale mitigation policy was implemented. The virus began spreading rapidly at an unimaginable rate, reaching venues such as schools, shopping malls, and amusement parks, with more and more red dots taking over the entire community. Let's put the deceased into the area and continue our simulation. Later on, most of the residents enter a temporary state of immunity after recovery, with the graph on the left showing the change in the number of hospitalized patients throughout the process. We can see that the number of deaths appears to be only a fraction of this community of 10,000 people. The consequences of allowing the Omicron variant to spread uncontrolled don't seem to be that severe, but is it really? Here is some nationwide simulated data demonstrating the daily progression of an uncontrolled Omicron epidemic in China. We then further distribute the spread according to population density across the country. As it shows, the demand for intensive care units would soon surpass the white curve. Vacant ICU beds would be filled with COVID-19 patients in an unprecedented manner, and hospitals would be thrown into chaos, resulting in a dire shortage of ICU beds and exceeding critical care capacity. In the worst case, the healthcare system would be overwhelmed with an estimated burden of 15.6 times the available ICU capacity. The above model simulation is from a paper published in the Nature Medicine on May 10, 2022, a leading international medical research journal. The study, using a 6-month simulation period, predicts that if China had not adopted a dynamic zero-COVID strategy nationwide, the epidemic would have resulted in 2.7 ICU admissions and 1.6 million deaths. As the 2022 Omicron outbreak hit Shanghai, tens of thousands of healthcare workers and specialists rushed from all over the country to support, and more than 100 makeshift hospitals were built to prevent overwhelming the healthcare system. For a country of 1.4 billion people, 1.55 million represent 0.1%. But for each family involved, it means the whole world to them. 1 million people in the US have died from COVID-19. As a result, more than 250,000 children have lost their primary or secondary caregivers. While the Western media questions why China chose to adopt a dynamic zero-COVID policy, we want to ask the Western media, how should China, a country with a much larger population base than the US, prevent itself from repeating the American tragedy? To achieve people first, life first, a dynamic zero-COVID policy is the answer. Spring will come again and flowers will bloom, but how shall we start over with lives that have been lost?